One of the recommendations for high blood pressure is to exercise. But as you exercise with high blood pressure, your blood pressure will lower quite quickly. So it feels like a bit of a contradiction as you feel dizzy and lightheaded, nausea, etc. as you're exercising with high blood pressure. But the only way to get that down is to exercise. If you're overweight or obese, is to exercise and good diet. I would recommend to stick to level 1 exercises, simple, no jumping, no up and down movements, until such time as your blood pressure lowers down to a more reasonable pace and stabilises. Lower back pain is quite a common thing amongst 80% of the population. Most lower back pain is caused due to tightness of the muscles and around the hip area and the hamstrings. I would highly recommend lots of stretching, building up strength and conditioning in the abs, as well as the glutes, to be able to support all the lower back, and use the posterior chain to be able to support your lower back in the movement. I would also, if it continues to persist, I would do a referral to an allied health professional to make sure that there are no injuries or anything that is of concern. I've had the privilege, as I've been doing my personal training with my mentor, to be able to work with a client who's had an ACL injury and replacement, which is removing a piece of the hamstring and putting it in the back of the knee. As part of her recovery, she was set up a plan through her physiotherapist and her allied health professionals that was followed. She's about 12 months into the injury now, but it was good to gain feedback from this client as to where she's at now, where she's been, the things that she's faced and the struggles that she's had. So obviously with an ACL injury, you would not do high impact things to begin with. It's small paced, it's stretching it out, and moving slowly until the client feels comfortable, and listening to the allied health professional's recommendations in her recovery plan. So obviously sticking to modifications and listening, and even further down the track when working with the client with a knee injury, if they express any concerns or pressures at all, get them to stop, slow down, get checked, work at their pace at all times. You don't want to continue to cause a worse injury. Same with the shoulder injury, it's a major joint area, lots of muscle structure around the area. Any form of injury should be checked by a health professional and followed up and worked through.